In the immensely long and ancient era of Rome, the development of healthcare progressed at a relatively slow pace, being shaped by a range of factors, including consistent observation, tradition, absorption of knowledge from numerous diverse cultures, and the evolution of an integrated system of knowledge. Roman medicine was not practiced as a pure and scientific concept in the contemporary sense. Rather, it was a meticulous, diligent endeavor to comprehend and unravel the complexity of the human body, using the scarce resources and ideas available during that time. Although a significant number of physicians initially studied and relied on the Greek teachings that dominated their existing knowledge, many later integrated their understanding of Roman culture while also embracing the sentiment that maintaining health and well-being were deeply connected not only to the individual, but also to maintaining balance within themselves. In their day-to-day practices, Roman doctors observed their patients with great scrutiny in order to gain a thorough understanding of their observations and symptoms, including fever, pain, fatigue, and any observed changes in behavior. By constantly monitoring these factors, they were able to identify the nature of the illnesses and establish potential treatments, with the numerous treatments often being simple, based on the fundamental concept of restoring balance within the human body. This concept involved adopting a diet and sufficient sleep, having vital roles in the treatment process. In addition to these strategies, maintaining cleanliness, adhering to a well-balanced diet, and promoting a healthy lifestyle were considered critical components of Roman healthcare systems. Moreover, Roman medicine extended beyond immediate treatment to encompass proactive preventive measures, addressing potentially harmful conditions such as pollution, dirt, and unhealthy living environments. The importance of maintaining cleanliness, regular air exposure, and bathing as routine practices was highly promoted, particularly within the larger cities, where bustling populations contributed to unsustainable environmental conditions. In spite of their limited knowledge and understanding, Roman practitioners diligently pursued their work, recorded their observations, and shared their insights, building a system that would inevitably leave a lasting impact on future generations. Although their methods might have been limited or clumsy, the importance of healthcare as an inseparable and crucial aspect of everyday life was undeniable and significant within the ancient world of Rome. This profound, meticulous approach to healthcare, encompassing a deep sense of responsibility and care, significantly contributed to the normalization and establishment of healthcare as an indispensable part of daily life for the citizens of that renowned civilization. Doctors in ancient Rome came from a wide range of backgrounds, and their levels of training and experience could vary greatly. Some were highly respected professionals, while others learned their skills through practice and observation rather than formal education. Many of the most knowledgeable physicians in Rome were originally from Greek regions. These doctors brought with them established medical traditions that had been studied for generations. Over time, their knowledge became integrated into Roman society, shaping the way medicine was practiced. Physicians often worked in different environments depending on their status and resources. Wealthy families frequently employed private doctors who lived in or regularly visited their homes. These physicians provided personalized care and ongoing treatment. For the general population, medical care was less consistent. Some doctors operated small clinics, while others traveled from place to place offering their services. Patients would seek help when illness or injury became too severe to manage on their own. A doctor's role was to observe, diagnose, and recommend treatment. Without modern technology, diagnosis relied heavily on visible symptoms and patient descriptions. This required careful attention and experience. Trust between doctor and patient was important. Successful treatments could build a physician's reputation, while failures could damage it. As a result, many doctors approached their work with caution and responsibility. Despite the differences in skill and knowledge, Roman doctors shared a common goal: to reduce suffering and restore health as best they could. Their efforts, though limited by the understanding of their time, represent an early step in the long history of medical care. Roman medicine made use of a variety of tools that were carefully designed for specific medical purposes. Many of these instruments were made from bronze or iron, materials that provided both strength and durability. Among the most commonly used tools were scalpels, which were used for cutting during surgical procedures. These blades were often small and sharp, allowing for precise movements. Forceps were also widely used to grasp or remove objects, particularly in situations involving wounds. Probes allowed doctors to examine injuries more closely, helping them understand the depth or nature of a wound. Needles were used for stitching, especially when closing cuts or surgical openings. These tools were often stored in portable kits, making it easier for physicians to travel and treat patients in different locations. The organization of these kits reflects a level of professionalism and preparation within Roman medicine. Although their tools were simple compared to modern equipment, Roman doctors used them with care and intention. Each instrument had a purpose, and physicians learned how to handle them with precision through practice. Cleanliness was also considered important, even if the full concept of infection was not yet understood. Some doctors washed their tools or exposed them to heat before use, believing this improved the safety of procedures. The existence of these medical instruments shows that Roman medicine was not only theoretical, but also practical. Doctors were willing to intervene physically when necessary, using the tools available to them to treat injuries. In ancient Rome, much of medical treatment depended on the use of natural substances, especially plants. Herbal medicine formed a central part of healing practices, as doctors relied on the properties of various herbs, roots, and oils to treat illness and discomfort. Roman physicians believed that different plants carried specific effects on the body. Some herbs were thought to calm pain, while others were used to reduce swelling or support digestion. These remedies were often prepared carefully, using methods passed down through generations. Herbs could be crushed into pastes, boiled into liquids, or mixed with oils to create ointments. These preparations were then applied directly to the body or consumed as part of a treatment plan. Each method depended on the condition being treated and the experience of the physician. Many remedies were simple and based on observation. If a plant appeared to help a particular symptom, it might be used again in similar situations. Over time, these repeated uses created a body of practical knowledge that guided treatment. Herbal medicine was also closely connected to daily life. Some remedies could be prepared at home using commonly available plants. This meant that basic treatment was not limited to doctors alone, but could also be practiced within households. Despite its limitations, this approach to medicine reflected a careful relationship with nature. Roman healers paid attention to their environment and used what was available to support health. Although these treatments were not always effective by modern standards, they represented an important stage in the development of medicine. They showed an early effort to understand how natural substances could influence the human body and assist in healing. Surgery in ancient Rome was approached with caution, but it played an important role in treating injuries and certain medical conditions. Roman doctors performed procedures when other treatments were not sufficient, relying on their tools, experience, and careful observation. Most surgical work focused on visible problems, such as wounds, broken bones, or foreign objects lodged in the body. These situations required direct intervention, especially in cases where waiting could lead to further harm. Before performing a procedure, doctors often prepared the patient as best they could. This might include cleaning the area, stabilizing the body, and attempting to reduce pain using herbal mixtures or simple sedatives. The procedures themselves were done with steady hands and focused attention. Without modern anesthesia, patients were usually awake, which made speed and precision especially important. After the operation, care continued. Doctors monitored wounds and attempted to prevent complications by keeping the area as clean as possible. Bandages were applied, and patients were advised to rest while the body healed. Despite these efforts, surgery carried significant risks. Without knowledge of bacteria, infections were common, and not all patients recovered successfully. Even so, Roman surgeons demonstrated a willingness to act when necessary. Their work showed an early understanding that some conditions required direct physical treatment. Through their attempts, both successful and unsuccessful, Roman surgery contributed to the gradual development of medical practice. It reflected both the ambition and the limitations of medicine in the ancient world. The Roman army played a crucial role in the development of organized medical care. As soldiers traveled across vast regions and faced the dangers of battle, the need for effective treatment became increasingly important. In response, the Romans developed structured approaches to caring for injured soldiers. Medical personnel accompanied the army, prepared to treat wounds and stabilize injured men as quickly as possible. Battlefield injuries often required immediate attention. Cuts, fractures, and other serious wounds were treated using the tools and knowledge available. Speed was essential, as early care could improve the chances of survival. Roman camps were carefully organized, and this organization extended to medical care. Designated areas were set aside for treating the wounded, allowing doctors to work more efficiently. In some cases, more permanent facilities were established near military bases. These early medical centers allowed soldiers to recover over time, rather than being left without care. The Roman military also emphasized prevention. Clean water, structured routines, and organized living conditions helped reduce the spread of illness among soldiers. This combination of treatment and prevention made Roman military medicine more advanced than many earlier systems. It showed a growing awareness that health was essential to maintaining a strong and effective army. Through these efforts, the Roman army contributed significantly to the development of medical organization. Their methods would influence how later societies approached care in both military and civilian settings. As a Roman medicine developed, the need for more organized care led to the creation of early medical facilities, especially within the military. These places, known as valetudinaria, can be considered some of the earliest forms of hospitals. Unlike modern hospitals, these facilities were not widespread across all of Roman society. They were mainly built to serve soldiers, who required structured care after injuries or illness during campaigns. Inside these buildings, patients were given space to rest and recover. The layout was often carefully planned, with separate rooms or areas for different conditions. This organization allowed medical staff to manage patients more effectively. Doctors and assistants worked within these facilities to provide ongoing treatment. Wounds were cleaned and monitored, and patients were observed over time, rather than treated and immediately released. The presence of these early hospitals reflected an important shift in thinking. Instead of only reacting to illness or injury, the Romans began to create environments dedicated to recovery. These spaces also helped reduce the spread of disease among soldiers. By separating the sick and injured from the rest of the population, the army could maintain greater overall health. Although limited in number and purpose, valetudinaria represent an early step towards structured healthcare systems. They show how necessity, especially in the military, pushed the development of more organized medical care. Through these facilities, Roman medicine moved beyond individual treatment and began to take shape as a more coordinated practice. In Roman cities, public health was supported by systems that, while simple, were highly effective for their time. Clean water, sanitation, and regular bathing all played a role in maintaining the well-being of the population. Aqueducts carried fresh water from distant sources into cities, ensuring a steady supply for drinking, washing, and public use. This access to water was essential in supporting both hygiene and daily life. Public fountains allowed citizens to collect water, while bathhouses provided spaces for regular cleaning. Bathing was not only a social activity, but also an important part of personal hygiene. Waste management systems, including drainage and sewer networks, helped remove unwanted materials from crowded urban areas. These systems reduced the buildup of waste and improved overall living conditions. Although the Romans did not fully understand how diseases spread, their focus on cleanliness had positive effects. Regular washing and access to clean water helped reduce certain health risks. City planning also played a role. Streets, buildings, and public spaces were often organized in ways that allowed movement, airflow, and access to resources. These efforts show that Roman society recognized the importance of maintaining a clean and structured environment. Even without modern scientific knowledge, they created systems that supported public health on a large scale. Through these practices, Roman cities became some of the most advanced urban environments of the ancient world.